Hello, so this is Science to See a Gynecologist. Visiting your OBGYN is something you know you have to do as an annual basis. But there are times when you may not feel like something about your body doesn't seem exactly right. Whenever you have womanly concerns that a gynecologist may be able to help you sort out, you shouldn't hesitate to call or make an appointment. Minor symptoms sometimes indicate major problems. So the best gynecologist will encourage you to be proactive with your health and know you are the person who is most familiar with your own body. So signs and signs to see a gynecologist. 1. Pain or burning with urination. Pain or burning through urinate may indicate a urinary tract infection. Women are more susceptible than men to developing UTIs. You may also have a fever or even blood in your urine. Have your gynecologist evaluate your symptoms and determine what is causing them and how to treat them. In general, UTIs are treated with a course of antibiotics. Your OBGYN will tell you what to expect from your particular infection. 2. Menstrual irregularities. When your menstrual cycle seems different than normal, or if it stops showing up at all, see your gynecologist. It could simply be by hormonal imbalance or stress, but it could also be a sign of ovarian problems, infection, or uterine anomalies. Ignoring menstrual irregularities could lead to reproductive problems in the future. Treatment for menstrual irregularities will vary depending on the root cause. Hormonal imbalance may be treated with specific hormone therapies. In other cases, the underlying ovarian problems will need to be addressed. For some women, however, treating menstrual irregularities may be as simple as lifestyle changes or taking a contraceptive treatment. Next, you need to see a gynecologist if you see sores or blisters on the genitals. A blister or sore on your genitals can be a sign that you have been exposed to a sexually transmitted infection. There are also other possible causes of sores that are not sexually transmitted, but often sores or blisters won't go away without medical intervention. So have your gynecologist check them out. Your gynecologist will also be able to run a full STI screening, helping ensure your reproductive and sexual health. In most cases, your OBGYN can also provide education, counseling, and advice that can prevent future STI transmission. Next, if you have a vaginal itching or discharge, or a foul odor can indicate a bacterial infection, yeast infection, or possibly a sexually transmitted infection. Most of the time, this type of problem won't go away on its own. It's important to have your gynecologist evaluate your symptoms so that you can be treated appropriately. Next, if you're having pelvic pain or lower abdomen pain, there are a variety of possible causes for pelvic pain or lower abdomen pain. Some causes of pelvic pain include endometriosis, fibroid tumors, ovarian cyst, and ectopic pregnancy. You may also have a condition called pelvic inflammatory disease. Pain and discomfort of any kind are the body's way of letting you know that something is wrong. 6. If you're having painful intercourse, some of the same problems that cause pelvic pain in general can cause pain during intercourse. Some women using lubrication is all that is needed to make sex less painful. If that doesn't give you relief, your gynecologist can look into the other possible causes, which could include the same things I listed above, infection, pelvic inflammatory disease, just to name a few. Your doctor will be able to be the person to find the solution to this problem. So, the last thing is breast pain or abnormalities. Any abnormalities with breast should be checked by a gynecologist. This includes breast pain or discomfort, lumps, inflammation, or swelling causing new asymmetry not related to menstrual cycles, in discharge, or bloody discharge from your breast. Another reason to call your doctor is to notice any changes in the nipples, such as crusty or skin, redness, swelling, or warmth, are other signs that should be reported to your doctor. So, it's very important to see a gynecologist. And if you have any of these following signs or symptoms, it's time to see one right now. Many of the symptoms and issues described in this video, at first, as little more than a nuisance. As such, You might be tempted to delay your trip to the OBGYN. However, there are advantages to swiftly bringing your symptoms to the attention of a gynecologist. As an expert in women's reproductive health, a gynecologist will be able to more quickly and accurately detect and diagnose health issues concerning your reproductive system. But more than that, your gynecologist can help you put your symptoms into context of your broader reproductive health, give you general reproductive health advice, provide specific screening, diagnostics, tests, and advice for your reproductive health. And if your symptoms or concerns require ultrasound imaging, that can be often performed on site. In many cases, if you bring these particular health concerns to your family doctor or general practitioner, you'll be likely to receive a referral to your gynecologist anyway. So that's it for this video.